Good afternoon, everyone. I certainly would like to thank the meeting organizers and certainly all of you. I realize that I am right up against you and the end of the day, so we'll do my best to keep it interesting for you. I will share with you that coming from a medical affairs background within the pharmaceutical industry and typically attending scientific sessions, this by far is way cooler. So what you guys do here is really awesome and really, really do appreciate the opportunity to present to you, what we have done within medical affairs at Sanofi. These are the topics that I'm going to address and go over with you this afternoon. While it can be normal in your business, I have to share with you that the pharmaceutical industry has been slower to adapt to this delivery system and how we prepare, develop, and deliver information. We certainly are working very hard to shift that paradigm. The first topic that I'm going to speak to you about is shifting that paradigm from a pharmaceutical perspective. The project that I'm speaking to, the platform that I'm speaking to, we refer to as GRASP. There are essentially three elements to our problem. One of them is that we have significantly large amounts of information. I can share with you that we're not really sure if that information is understood, and we have no knowledge of retention rates. So how can we educate? How can we make that educational shift? And if you don't know, in the pharmaceutical environment, which is an extremely regulated environment. So we turn to non-traditional industries that are regulated and not regulated. And we said, well, how are they changing how we receive information? One of those that we looked to, one of the industries that we looked to was home improvement. We looked at Lowe's and their do-it-yourself home store and their VR room that they use to visualize that brand new kitchen. So we went out of the box and certainly went to those different industries. Our company's chief medical officer, he launched a hackathon about a year ago. And it was really for the medical team, and again, this is within medical affairs within the whole organization of that pharma company, but for medical to look at what was the low-lying fruit, what are problems that we could solve, while at the same time incorporating his overall digital platform. And so that is where we entered our program, GRASP. So it actually started as an individual project, again, within our scientific communications group, within medical affairs at Sanofi. And, as we began to evolve, we actually extended it out and we really looked at how we're delivering information across the company. So it was a platform approach. It certainly is aligned with adult learning principles, but again, and we'll learn a little bit more about that in just a few moments, but really looking to those other industries to help transform our organization. And certainly the Lowe's VR room, we were quite confident, we can do this, and certainly from a pharmaceutical perspective. So where we were was that our biggest issue was, as simple as it sounds, but is our information understood? Is the information retained? And so those were the two really big questions that we were attempting to answer. And certainly the answer of virtual reality, it certainly was there with us because within that closed system, typically what you will see is a 50 to 60% greater retention of information, and certainly in that VR setting versus that traditional learning session where there's someone that's lecturing and you're listening and you're taking notes. And so the closed system, it certainly yielded greater retention rates. So in the pharmaceutical industry, I will share with you and somewhat specific to Sanofi, so I need to be there. But the way that we educate now, I have to share with you, is a little old-fashioned, just a little bit old-fashioned. And so we clearly needed an update. And so with our submission to the hackathon with the GRASP project, we were looking to develop and gain a way of educating not only HCPs, but also patients, to ensure the right patient gets to, or the right treatment rather, gets to the right patient. So in our brainstorming and looking to what we were going to submit to the hackathon, we actually looked at where learning occurred across the organization. one area there where is a significant investment is within a group called Independent Medical Education. You may say, what is that? And it really is educational proposals that are submitted to the company as a result of the distribution of a request for proposal or an RFP. And so in that RFP, we asked for innovative models using AR, using VR, and the results were actually astounding. We were very, very pleased. And so this was incorporated into our overall GRASP submission. So it's important to note that in those independent medical education, again, that traditional style of learning, the program usually has a pre-test, it has a post-test, it does a measurement of knowledge, and usually we see 8 to 10% increase in knowledge. And that's actually with HCPs who are actually knowledgeable in the area. So that again is generally what we see. On this next slide, what you see is actually when we use the VR, and so we see a pretty big jump. And so the knowledge increase, it ranged from 19 to 21%. And what was really more with these data points, and I think really critical to point out, is that the participants in this particular activity actually wrote the guidelines. They actually wrote some of the data that was in the education. So we really expected something much lower. We expected that it would be 4 to 6%. So when we saw the actual 19 to 21%, it was really amazing for us, and certainly we're very happy about it. So due to the novel delivery of the information, the Congress had 400 attendees, and 240 participated in the VR activity, completing the pre and post test. 231 ordered customized posters, and this, it had QRS codes and allowed the physicians to take it back to their patients and bring the molecules to life, and utilizing smartphones. So again, extending the learning. We also had a component within this program, augmented reality, that was pushed out to diabetes educators, and I'm happy to share with you that we also saw the 19 to 21% increase in knowledge. Most importantly, I think, there's a lot of increases knowledge and certainly retention, but was that 92% of the participants in the activity actually said that they were going to use the tool and the education really to work with their patients on medication adherence and persistence. Those are two really critical components for a patient in their medical journey. So that was really astounding for us, and we were extremely pleased with those results. So for the second area this afternoon that I would like to talk to you about is one that it weighs heavily for us within the pharmaceutical companies in terms of our regulations and what we can and can't do. I really don't necessarily know of too many organizations that are more heavily regulated than we are. So I share with you that the greatest obstacle, I think, that I certainly learned and took away from this project was in any technology, when you're implementing it, one of the places you don't want to be is living with SOPs and regulations that were actually built without the present technological ecosystem of which you're working in. So we had definitely some challenges in front of us. We decided to fast track it. We were like, wow, if we're going to get this and get it moving, we're going to use approved materials. And so some of you that may not necessarily be familiar, any type of communications that we have external to the company have to be approved by medical, legal, and regulatory. So in the development of the VR experience, we were like, you know what, we're going with approved materials. And so it made it much easier. We were able to fast track. Another item or action that we took to get through this regulatory wheel was concept reviews. So we sat down with the head of legal, we sat down with the head of regulatory and said, this is what we're doing, this is where we want to take it, these are the target audiences, what do you think? And so by having that forward motion of understanding what could we run into and how can we get past any type of hurdles that we might have. I will share with you that I think that was a pivotal moment for us, certainly because not only we were gaining their information and certainly their expertise and their feedback, but we're also gaining their advocacy. And so down the line, if I were to run into an encounter that didn't go so favorably, I could bring in the head of legal, and he was very supportive of our efforts. So extremely, extremely helpful in that regard. Surprising for us, it wasn't so much a focus on the content. We were really thinking like, wow, they're going to look at the content and how it's delivered. It was actually, from a legal and regulatory perspective, it was a focus on the technology. And so our vice president went forward and she made a triumphant argument and said, listen, just think about when iPads were released. Back then, we were like, and again, this is from medical inside of pharma, we're like, oh, we're not using iPads with HCPs, with the doctors. No, we would never do that. And so it was a really, really drive home and saying, listen, this is how quickly it moves, and certainly that got us through that hurdle. I have to share with you and say that I can't emphasize the valuable experience and the importance in the partnerships with ITS, with legal, with regulatory, with our CMO office, to get the project fast-tracked, to break down the barriers, and I have to say, to remove those innovation killers. So it truly was a definitive experience for us in being able to really get past many hurdles. So the next group in our journey and that we met was our end users. And so this is our field-based medical team. These are individuals that are actually interacting with physicians, with your primary care physician. They're interacting with the NP, the PA, those that you may see in your own personal lives. The medical liaison, they're not selling product. They're educating on disease state, they're educating on therapeutic classes. So the information and the exchange is very different than you might think of in terms of selling something. And so this is the information that we were building. Very critical to have those users at the front of the process. It certainly can't be overstated. It was very critical for us. They gave us feedback of the experience that we certainly hadn't thought of. And actually, we gained a team of people. This was like a win-win for us, that we were able to gain our VR pilots. 27 of the 60 said, you know, have at it, we'll test it for you in the field. So it was really critical, and I think this was a pivotal moment for us too, our second pivotal moment, that gaining the insights from the medical team that's in the field, that's interfacing with physicians, it was really a movement of now how we can use the technology in the company, and certainly not it just be a pilot anymore. So again, this was a very critical juncture in our journey as well. As you can see on the slide, option 2, we gave them different options to choose with the specific interaction that they would have. And they actually said, that they wanted option 2 because they wanted to be aware of the surroundings in the office and not, be locked out of what was going on around them. So again, a critical interaction and certainly valuable input. So the last area this afternoon is the wearable devices across the business model. And I'd like to share with you that I really believe what made this program a success is that while we're a group, scientific communications within medical affairs, we didn't just build this for our group. We actually said, let's look at the business as a whole and really look at who else has similar issues like we do. And I think that that's where the difference came in, and who would benefit from the technology. Certainly, there are others that had the same issues, and certainly others that would benefit from the technology. So we weren't able to address all of them in the pilot, but share with you that an evaluation of all of these groups has occurred within the last year. So on this next slide, to most of you in the room, you may be like, oh my goodness, what does she have on that slide? But I share with you, in our journey, we looked at many different ways of using headsets and understanding the different environments and how it was going to be used in that environment. So as you know, many of these headsets are already outdated, right? They're done, and they're just, so has been. But I really wanted to bring your attention to a few of the reasons for our choices. In the first headset, you can see that we actually chose that to use with HCPs, And then a little bit further down the road, from a breakage perspective and a cost perspective, we were like, oh my, this cannot go out with our field medical team. The second headset, it was actually really awesome in that it was printed from Amazon. This was a prototype for our virtual clinical trial recruitment. It can actually be placed into a starter pack with a sample medication and an overall learning objective. It can be flat packed and mailed very inexpensively. So it really turned out well for us. And the third one is a throwaway plastic headset, and that's where we landed with our field medical team. The cost is less than $2, and the breakage certainly wasn't an issue. So we've had the good fortune to be able to present our project both internally and externally around the globe. And I'm certainly grateful around the globe, internally, externally, and to be here today as well. Very, very pleased that we were able to work with Dr. Daniel Kraft from Singularity University in Exponential Medicine. And he had shared with us that he had seen PCSK9 molecules. That's a very specific type of lipid molecule. And he said, I've seen it explained for 10 years, but I was able to quickly understand it in a 3-minute VR. And so, Dr. Kraft has certainly been an advocate, and we certainly love our partnership with him. I would strongly suggest that to any of you that would embark on this same type of journey, that one very important aspect for us was who were the vendors that we're working with, and certainly who we're collaborating with. And so many say they can do VR. This was our experience. Many said that they could do VR, but they really didn't have the capability to work with a large organization such as ours. So that was very critical, and I think that vendors who understand the pharmaceutical industry, and again, those collaborations are incredibly important. So Dr. Kraft was gracious enough to give us an opportunity to have a booth at Exponential Medicine to showcase the GRASP program. And what you see here are people from various industries, including some team members from Google that came to this activity and actually looking at our information and seeing how it works. On this next slide is the Sanofi booth at Viva Tech in Paris this past April. We did a VR there on cardiology and heart disease, and this was for the general public. So this was for patients or anyone that would be interested in this topic. And it was really incredible for us. It was a very rewarding experience in that we had 3,000 participants that went through the activity in just 3 days. And this next slide, this is like this is really the engine behind the project. This is a picture of the teams who help bring these projects to life. And I share with you that coming from a medical affairs perspective, we are very, very grateful for these internal teams that we work with. No program builds on a single team. And I have to share with you that these are just a few people from very, very many different groups and that worked on the project. And it certainly goes beyond those pictured here. What was truly remarkable through this journey, again, within medical affairs, within the pharmaceutical industry, was that people started thinking differently, and again, within our industry, and not really encountering this type of project and implementing something of this magnitude. Really, people started thinking globally and definitively more collaboratively. So it was truly a win-win for us. So I'd like to end this afternoon and share with you a video that we had actually built and prepared for i4Pharma. We were actually runner-up for the top 5 HCP educations programs that were available within the US within the past year. So I'll share the video with you now. Thank you.
New methods of educating HCPs are essential to optimize patient care. To address an educational gap in the management of acute coronary syndrome, we evolved an engaging learning experience through a digital platform, GRASP, an interactive virtual reality experience that immerses HCPs in the journey of a patient. The results? HCPs increased their knowledge by 18% compared to 8 to 10% with traditional methods. 91% of HCPs said the program provided strategies for referral and medication adherence. GRASP has redefined scientific exchange with HCPs, continuing to improve the lives of patients.
So I'd like to conclude with my thank you to all of you, and certainly available if you have any questions. Thank you very much.
So in these training sessions that you've developed, was that the only mode of training? The whole course was done with VR, or did you have a more traditional part with a VR as a supporting supplement?
So the one program that I described to you, there was multiple elements to that, and so typically what we do, and as I spoke to the Scientific Congress, is that we would have the virtual reality with the Oculuses at the National Congress as a live activity, and participants there would do a pre-post test before the activity, after the activity, and then we would follow up with the augmented reality. And so a part of adult learning principles is reinforcing the education. If I were just to have you do the virtual reality and you leave today, most likely your retention is just not going to be there. So we have the augmented reality while the physicians were on site. They also were able to customize posters, again, that had QRS codes, to create that with their smartphones in the offices with their patients. So most of the programs are multi-component, and just recently in June at the American Diabetes Association, we actually have gone beyond using just the Oculuses to using the cylinder room, so a virtual reality room ourselves. So watch out, Lowe's. And so we were able to do that, and it was a tremendous success for us. And again, what we're finding is that we could make an investment and do a traditional didactic lecture, and we'll have 600 people in the room, and they'll do a pre-test and a post-test, but the knowledge changes and the retention rates are significantly lower than using the virtual reality or the virtual technology.
Oh, I'm Sarah Peterson from Medtronic, and I've been wondering...
Over here.
Oh, sorry. What other areas are you intending to bring VR into? Do you have future plans to have it in your manufacturing or other types of facilities?
Yeah, so there's actually separate arms within the organization, to your point, that are working, again, to evolve the overall digital platform. This is just one aspect of it, and coming from a medical affairs organization, and it may not necessarily seem apparent to you. This was a real heavy lift for us, and we've kind of led the charge, and we've actually become a proof of concept for some of the other groups. So our R&D division and certainly manufacturing, everyone has a similar type of effort, and we're essentially rolling everything up into that chief medical office. And so now that's where that globalization as well as the collaboration has really extended in the organization. And so it's kind of exciting for us because it puts a little oomph in our day that really isn't there when you're just looking at data and analysis and things like that. So everyone's very excited, and certainly those other areas are moving forward just as well.
We have time for one quick question. If there is one. All right, well, thank you.
All right, great. Thank you.